Hello everybody, I'm Dr. Fuad Khan and I'm a psychiatrist, and I'm the medical director for the psychiatry services at Wentworth Douglas Hospital in Dover, New Hampshire. Today we're going to talk about early serious mental illness, first episode psychosis, and duration of untreated psychosis. These are three very important concepts that we need to understand when it comes to dealing with serious mental illnesses. But before I go there, I want to talk a little bit about a philosophical issue and a deeper issue that I see all the time. That thing is that, we treat ourselves differently when it comes to illnesses of the brain versus the illnesses of other organs of our body. When it's the other organs of our body, it's very much like, for example, Joe has cirrhosis of the liver, or John has a stone in his kidney. We tend to think of the illness in the form of an organ having it. But when it comes to the brain, we identify with the brain as part of us as an individual, us as a person. We link that directly. You never hear anybody saying, Chris has schizophrenia of the brain, or John has major depressive illness of his brain. We always say he is schizophrenic, or he's depressed, or he has depressive illness. This lends itself to two major things. One is that when we see that our brain is defective, we see ourselves as defective. We see that the error lies in us. We do not see it as a problem of the brain. And so we can't separate ourselves from an organ. We can't see the medical model or the disease model of the illness thoroughly and clearly. It just creates a situation where we feel ashamed when we have a psychiatric illness or a diagnosis. We think it's us. People think that way. And even the medical field contributes to this, and we all end up with this thing we know very well, the stigma. The medical field contributes to it too indirectly by, for example, attributing ultra secrecy to their notes. And so it is as if there is a matter of some judgment or shame, and we must hide those things. The truth is, this is an organ, it suffers from its illnesses. Now, the other major issue that happens when you get a disease of the brain is that it is our brain that really detects things, analyzes things, and makes a plan to handle things. So when our brain is intact and our mind is functioning fully, and if we get an injury of our leg, or for example, or a disease of our gallbladder, our brain detects it, figures it out with the help of a team, makes a plan, and carries out that plan. But when the brain itself gets affected, its ability to do all of those things, the executive thinking process about the problem, becomes affected and limited. Many times when you have an illness which is as serious as a psychotic illness, where reality testing becomes an issue, it becomes even more challenging because the brain may not even know that it is suffering. And in that situation, it becomes a very difficult experience for not only the patient, because he's now at risk of deterioration and being affected by the illness, but for the family members and very much for the healthcare professionals. Helping a patient agree to the fact that he's got a problem and he must do something about it becomes a challenge in its own rights, and many times it's a source of frustration for professionals. How to handle that is an art in itself, and we can talk about it separately. So these two things, the fact that an illness of the brain becomes the illness of the individual as a whole and lends itself to stigma and shame, and the other that it creates an impediment in understanding that I have an illness and how must I treat it, are two very important things. Now, coming to serious mental illnesses, what is a serious mental illness? It's really no different from any serious illness. Any serious illness will affect your functioning and will be at risk of deterioration, especially untreated, like diabetes, like a cancer, like hypertension or heart disease. What are serious mental illnesses? So bipolar disorder, major depressive disorder, schizoaffective disorder, and schizophrenia are often clumped as serious mental illnesses. These are at risk of affecting your life significantly, and these are at risk of deterioration if untreated. Early serious mental illness, well, most of these illnesses actually present in late teens and early adulthood. It's a crucial part of our lives when we are taking the challenge of being on our own, we're developing a career, we're engaging in new relationships, possibly beginning and raising a family, crucial part of our lives, and we get affected by these illnesses. It can just put a big dent in our aspirations, in our goals of life, and can not only just arrest them, but bring along with it a sense of stress and sense of failure that further contributes to those illnesses. So it's very important to treat them early. And as I move into the first episode, psychosis, let me talk about the concept of duration of untreated psychosis. For a lot of other illnesses, it's known as well, but for psychotic illnesses, it's very clearly known that the longer the duration of untreated psychosis, the higher the risk of ongoing deterioration, and also higher the risk of not being able to return to pre-morbid functioning. So all the more important that detect it early, treat it early. Now let's see, what is first episode psychosis? Well, first episode psychosis is actually, the precise term would be a different one. First noticed episode of psychosis. There's no such thing as a first episode of psychosis that happens in the emergency room. So typically a patient shows up with an episode of psychosis. It's usually not their first. Unless, of course, it's nothing to do with a serious mental illness and it's because of a result of an intoxication or effect of a drug, whether it's methamphetamine, whether it's a high dose of a hallucinogen, or whether it's a steroid. But once you get a person who has an episode of psychosis, remember, it may be just the tip of the iceberg. It's the first showing of that problem. The person may have had it brewing for a long time. And that is where the duration of untreated psychosis has begun. Only we think that this is the first time it's happening. So first episode psychosis heralds a dangerous illness, which could be schizophrenia and schizoaffective disorder. I call it dangerous because people take a long time to gain insight into it and treat it. It shouldn't be dangerous with the availability of modern new drugs, and especially long-acting injectable antipsychotics that have shown a lot of promise in treating and preventing deterioration and improving outcomes. So this is about first episode of psychosis. Let me summarize what I talked about. I think it's very important to understand the illnesses of the brain get identified as the illness of our whole sense of self. It leads to stigma and humiliation and shame. It also leads to failure of development of good insight and good planning how to treat it. Early serious mental illnesses are bipolar disorder, depressive disorder, schizophrenia, schizoaffective disorders, and they have a very high chance, if untreated, to deteriorate and to affect our lives in a major fashion, interpersonally, professionally, and academically, and vocationally. Duration of untreated psychosis is an important concept, and it gets applied to other illnesses as well. You want to treat depression, bipolar disorder, all of them as early as possible and as consistently as possible, so that they don't contribute themselves to further stress and deterioration. And then lastly, we have to remember that the first episode psychosis may not be the first real episode of psychosis. It may just be the first noticed episode of psychosis. Thank you very much. I'll be very happy to receive any questions. Bye-bye.